Hello everyone, welcome back to the channel. Sometimes we used to just joke around saying that if our careers don't click as a neurosurgeon, we always have an alternative option. You know what that is? To become a barber. Yes, that's because at least some of us, if not all, don't really mind clipping or cutting the hair just before the operation. And on an average in India, a neurosurgeon, except a few, operates 70% of the cases on the head, that is on the brain, while the rest 30 to 40% may be spine or other peripheral nerves. And majority of them, except maybe few, prefer cutting the hair at the incision site. The amount of hair clipped and the duration at which it is clipped varies from neurosurgeon to neurosurgeon. And it also will depend on the site of incision in the head and the length of the incision. While some neurosurgeons prefer complete shaving of the hair irrespective of the site and the length of the incision, a few like me prefer only selective clipping of the hair, and based on the length and the site of incision, we end up giving crazy hairstyles to the patient.
Oh no!
When exactly we cut the hair, this again varies from neurosurgeon to neurosurgeon. While some of the neurosurgeons prefer complete hair clipping or complete hair shaving one day prior to the day of operation, followed by a thorough head bath and then shifting the patient to the OT on the day of operation. While others like me prefer clipping or cutting of the hair inside the operation theatre. Well, there is no proven benefit of either of the methods. It was just that we were taught at AIMS that in case if we cut the hair one day prior to the operation, there will be obviously small minor cuts at the site of hair clipping. If it's kept like that for more than 12 hours, bacteria can settle there, colonize and slightly increase the risk of skin infection at the site of incision. So to avoid that, we prefer cutting the hair inside the operation theatre just before we give the skin incision. Well, as I said previously, there is no proven benefit of either of the methods. Well, there are also a set of neurosurgeons who argue that it is not at all necessary to cut the hair during the operation. They just comb the hair accordingly, make some space and then give incision right over there. Well, going by the studies, they're not wrong. Studies have not shown that clipping the hair decreases the risk of infection. But post-operatively, maybe maintaining the wound clean becomes much easier if there's no hair around it. What do you say? Well, there are a few set of operations where almost all the neurosurgeons, irrespective of the site of incision, prefer complete removal of the hair. These are the operations where preventing infection is of utmost importance, like these. A lot of patients also ask me about the hair care after the operation. That is, when can they take bath, when can they apply, that is, water, soap, applying oil, applying gel, hair cutting or hair coloring, etc. See, the thing is that scalp, this is scalp. Scalp basically has a very rich blood supply, that is very high vascularity. That is the reason it bleeds profusely in case of any cut in this region. So the advantage of having a very rich blood supply is that the wound heals very quickly in scalp compared to other part of the body. So beyond 3 to 4 days, it is actually okay to put water and soap on the wound. While applying things like oil or gel can wait for 2 to 3 weeks because they attract a more dust deposition. Once 2 to 3 weeks are over and even the stitches are out, there is nothing much that you need to do. I mean, you're free to have a haircut, have hair color or whatever you want. Having a skin infection or the surgical site infection is very, very rare on the head compared to the other parts of the body. The reason being the same as I mentioned previously, because the scalp has very rich vascularity. So high amount of blood supply also means that the local immunity is pretty good and it doesn't allow the bacteria to grow and flourish that easily. But there is an exception. That is, any operation done on the back of the head, so called as posterior fossa operations, In these operations, there is definitely a risk of skin infection. That is because in this region, a fluid around the brain called as CSF can leak out because of multiple reasons. I will not go into the details of that. This CSF can leak, and in case if the skin is not closed properly, or if the wound is not closed properly, it can leak out of the wound, and because of this continuous leak, the surrounding area being very moist, skin infection in this region, that is the back of the head, is not uncommon. It can be seen. Well, this was a short video about hair clipping or hair cutting neurosurgery and hair care following the operation. I hope you found this small video informative. If so, give it a thumbs up, share it with your friends and family, and for more such informative videos, subscribe to this channel. Thank you for watching.